Here she is. Hi.
Hi, how are you?
I'm well. How are you?
I'm doing well.
Welcome, welcome. So
Thanks for
I was
having me.
I was just telling everyone that every week we have what's called Mentorship Mondays, where we'll have a conversation with different minds. Those are mentors, where we talk about your career path, your goals, um, how you came to be interested in your field of work, and also advice for people who are interested in doing the same. So I gave a little bit of background, but I'm going to pass the floor over to you so you can just talk a little bit kind of about your journey and what it is that you're doing now.
All right, sure. So just to get started, my journey was a little bit non-traditional in that I went through school, went through secondary school in Jamaica, through high school, and then community college because we didn't have upper and lower six. So I
Yeah.
did my high school training at Montego Bay High School, and then
Oh,
I went to Montego Bay Community College to complete what's called lower and upper six, or here it's like 12th and 13th grade.
yeah.
And then from there, I applied for undergraduate school in
Mm-hmm.
the United States, but I also applied for medical school on the island. And then I decided,
Mm-hmm.
let me see, let's be open here. Let's see what opportunities are out there.
Yeah.
I got into Columbia undergrad, and so I decided to matriculate there.
Mm-hmm.
After which I really enjoyed. I had a volunteer opportunity where I worked in a nursing home, and I
Mm-hmm.
really enjoyed the medical care, so I decided to go to medical school for sure.
Nice.
And that's where when I went to Emory, and now I'm back at Columbia completing my pediatric residency.
Okay. And how far are you in your residence?
So this is actually my last year. I'm a third year. Super excited about to graduate in June, although in the middle of a pandemic, that's a whole other story, but I'm super excited to be done.
Yeah. So what's next after you finish your residency?
So next, you have two options: either apply to fellowship or just enter the workforce.
Mm-hmm.
I am dabbling in both. I'm considering applying for fellowship as a hospitalist for pediatrics to work in the hospital as like a hospital wards doc. You require 2 additional years of training if that's something you're interested in. If you want to stay at an academic center like Columbia.
Mm-hmm. Oh. So could you talk a little bit about just what your everyday responsibilities are as a resident?
Sure. So as a resident, it's dependent on the rotation that you're on, but for the most part, as a pediatric resident, you are either in the hospital or at clinic. While in the hospital, you arrive, say around 6:30.
Mm-hmm.
You look at the list of patients who are hospitalized and who are on your service, and you kind of go through the chart, look at their blood work, look at any imaging they've had, like a chest X-ray, etc. Um, Look at what medications they're on and come up with a plan for the day. See the family and come up with a plan for the day.
Mm-hmm.
8 to 9 is usually some type of educational activity like a lecture. And then from 9 to 12, we're usually rounding, which means as a team, which consists of the medical student, resident, attending, who's the most senior doctor, we're walking around the ward and making management plans for each of the families, touching base with them, also making sure that they're aware of the plan for the day, etc. Then from 12 to 5 is what we call basically work rounds. This is where you're calling consults based on the plan that you came up with. Because you're a generalist, you might need the input of a specialist, say like an ID doc or a cardiologist, etc., to weigh in. So you're touching base with them, calling them, and actually executing those management plans for the day. And then between like 5 or 6, you're preparing to just wrap up for the day and head home.
Mm-hmm.
Mm-hmm.
So your days are typically about 12 hours a day.
Typically, at my program, we do 24-hour shifts. So yes, we have about 4 to 6 24-hour shifts a month. It's not every single month.
Okay.
But 6 to 7 months out of the year, I am in the hospital for 24 hours, and that means that we cover the day and night. What I like about that is because some programs do 12-hour shifts where you do a 12-hour day, 12-hour night, but then you have like a string of nights. That's how they cover their nights. My program, they just have one person do a 24. What I like about it is that you're there during the day, so you're hearing the management plans and the discussions. So when you have to manage the patients on your own overnight, it's not as intimidating because you were there during the discussions.
Yeah, that's fair. So how did you choose pediatrics as your specialty then? Because you said you volunteered in a nursing home, so that would be geriatrics, right? So how did you get into peds?
That's a good question. So that was prior to medical school.
Yeah.
In medical school, I feel like a good number of us go into medical school thinking that we know exactly what we want to do, and then you just have more experience. You know, this is where you actually rotate on the different rotations. So you have the adult medicine, childcare and pediatrics, and then like the surgical fields. I quickly learned that the OR was not for me. No interest in doing surgery, zero. And it was during medical school that I developed my love for the pediatric population. Honestly, I find kids to just be super fun, and they bring like diversity to my day. They're really cute, and what I like the most was that I feel like we have the opportunity to touch the lives of small humans and to basically help them map their way through their development into young adulthood and as full-grown adults. So I felt like there was a lot of preventative medicine that we could do on our part. Not to say that adults are already broken, but a lot of them have already formed their habits, and it's harder.
What do you think are some of the biggest challenges of working with children? Like, if they're coming to you, it's typically because something is wrong, right? So what do you think is the biggest challenge of working with like the children who may or may not have a condition that that you can help?
Right. So as I mentioned, there are two settings, inpatient and outpatient. Our clinic patients tend to be a little bit more stable, and they're truly well children, and they come in for vaccines, etc. And that's where you're able to interact with like a healthy child, and I get so much joy from my day from that. This is where I get most of my giggles. And just the other day I was in clinic, and this boy that I diagnosed with autism ran up to me and said, doctor, and I was like so shocked because he wasn't speaking prior to the intervention that we started. And so that's what brings me joy. I will say I do work at a tertiary institution, so we do have super sick kids on the inpatient side. And of course, it's devastating when one of them passes, or to see them go through their health condition. But what does bring me joy, and you just try to find the happy moments in just the little things that you're able to accomplish, the families that you're able to walk through this difficult time, and then the kids that we actually do heal, like to see a child come through our ED super sick, and then weeks later watching them walk out of the ED, of course that just fills me with a sense of accomplishment.
So I feel like when you're doing this type of work where there are like so many elements of joy and fun, but there's also like such weight and heaviness and seriousness to the work, what do you do to kind of find balance? What does your self-care routine look like to make sure that you're not bringing your work home and carrying it with you like at all times?
So I'll say it's twofold, right? There is some importance to not bringing your work home, but there is also some importance to decompressing and actually talking about your experiences and healing via debriefing and talking to your family members. And that's super important. So that's one. And then two, of course, I just make sure to make time for my other interests. I'm super big on family. So our call, I always make time to call my mom. For instance, that's priority to me. I talk to my mom every single day, if it's even for 5 minutes.
Oh, wow.
She's actually calling me right now, which is why the video keeps cutting out.
Oh, I love
Sorry
that. And
about
then the
that.
first time when it didn't go through, she was like, we're just going to try again.
We're just gonna try again.
Again.
Yeah. Sorry.
So it's okay. So how has your work been impacted by the pandemic? I imagine you guys have seen quite a bit, and especially being in New York, which was one of the hot spots for COVID-19 infection rates.
Right. So that's a very good question. Our job has been affected in many different ways. So as we already spoken about, I am a pediatrician.
Yeah.
Luckily, the rates of morbidity and mortality in children has been low with the coronavirus. Not to say that the number of children infected with it is any less, but the rates of mortality and morbidity are lower, which means that the numbers we saw in our hospital could not compare to the numbers they saw in the adult hospital. I just want to make that clear. With that said, though, of course, they mobilized all of their physicians to help in any which way they could. So I was actually in the pediatric ICU, which is where you have your sickest of children, during the midst of all of this, and they transferred adults to our ICU. And so 2 years ago, when I was applying to be a pediatric resident, I could not have imagined that I would be taking care of adults, let alone in an ICU setting. So that was tremendously different. Additionally, in our EDs, we've just been seeing less cases of children, because parents are so worried about bringing their children to the ED, worried that they'll contract coronavirus from the healthcare providers and other children. Yeah. Same thing with our clinics. We saw less patients initially on purpose to lower the risk of transmission, and then we moved to telehealth. So that was, telehealth sessions were something that people were probably doing 10%. And the rates of telehealth sessions spiked because of coronavirus. So that was new for me. I was seeing patients over video and coming up with plans without being able to physically touch or listen to a patient and just come up with a plan over the phone, which was challenging in its own way.
So what did you study to prepare for your career in medicine? I know you talked a little bit about your trajectory and doing some volunteer work, but if you can talk about kind of your undergrad academic experience and studying for the Mcats and
sure,
what that looks like.
So as I mentioned, I could have gone to medical school directly from Jamaica and go to the University of the West Indies, which would have been a great option. Multiple of my friends have done that actually. And one's in the US with me now. So she did a different path where she went to the University of the West Indies and then is now doing residency in New York. I decided, I think at the time, I felt like I was a bit undecided and wanted to explore other careers in science. So that's one of the reasons Columbia was an attractive option for me. At Columbia, I did bench research, with laboratory mice and C. elegans, etc. So I did the whole research path to see if that's something that I would enjoy, getting a PhD versus an MD. And as I mentioned, slowly I realized that I just liked the social aspect of being a doctor more so than going into a lab and working on specimens, etc., etc. And I liked the critical thinking that came with it, being presented with a problem of an illness or sick child and having to come up with that solution. Yeah. So through that, I decided that I was going to go the medical path. And of course, in preparation, so in undergrad, you actually declare yourself as pre-med. And so you take the courses necessary to study and pass the Mcat. And then you have time to study for the Mcat and take that test.
So when you're studying for the Mcat, did you do that directly out of undergrad? Was there kind of a gap period there where you were also doing research?
No, I was ready to honestly, I'm the type of person I just want to be done with my training. I wanted just 1, 2, 3 and be done with it. I didn't take any time off. For better or for worse. I studied for it, to be very honest with you. I studied for the Mcat in 3 to 4 weeks. But as I said, your coursework prepares you for it in a way.
Yeah.
So if you kind of do questions as you're doing your coursework, it prepares you for it. But in terms of dedicated time, I studied 3 to 4 weeks. I was working in a lab over the summer, actually. That's when I started working in the lab that I was studying C. elegans. And I was preparing to go to ATI right after the my test. So it was different compared to like USMLE Step 1, which is a more serious test that you do during residency, in that, at least the way I approached it, I kind of just took the test and just let go and let God, basically.
Sometimes that's the best way to do it.
Right. And now I will say, don't be disheartened, because on Mcat, I didn't get the score that I'd hoped for, to be honest. But that's probably because of the way I studied for it, as I just mentioned, versus in comparison to like USMLE Step 1 and Step 2, like I did really well on those exams in comparison to Mcat. And so I would say to anyone listening that along the medical path, don't be your own roadblock. Like, just really try and apply. Just go ahead and apply, and don't be the one to tell yourself no. Let someone else tell you no.
And there are multiple exams that are kind of incorporated into this process, right? Like MCATs are just the first step. You have boards, which come after your residency. Can you talk a little bit about that?
So actually, I'm not there yet. I'll have to take it in October of next year, I believe. And I'll start studying for it around that time. I've been told by my colleagues older than I am, who've already been through this process, that they've taken like a month to study for boards.
Yeah.
But once again, your residency prepares you for it. And we have like board review conferences that are dedicated to helping us prepare for board. So it's kind of like helping you along the way. And then it helps that I go to an institution like Columbia. To be honest, we are a tertiary center, so all the rare things that sometimes you think you'll never see that are tested on the board, sometimes we do encounter it. Yeah. But it's a lot of tests. It's a lot of tests. After I overcome the hump of Mcat, I do med school just to find out that, in a year and a half you have to do Step 1, which honestly I had no idea. I was like, what is this? And so that test is super intense. They're actually thinking about getting rid of it, is what I hear, because before the score you achieved on Step 1 determined what specialty you could do, in a way, because it determined how, just one test would determine how competitive you are. So there's some fields that the compensation is higher, like dermatology or certain types of surgeries. So you needed like super, super high scores to even consider applying for those fields. But now they're actually thinking about getting rid of Step 1, so it might not be an issue in the future. Then after Step 1, you feel amazing. Oh my God, I passed Step 1. There's Step 2. At least the names are straightforward, even though the tests aren't necessarily. There's Step 1 and Step 2. And then after residency in your intern year, you actually take Step 3.
Oh, wow.
Yeah. So lots of steps.
I feel like so much of this is kind of a blind process for a lot of students. Like they think about wanting to become a physician or wanting to become a surgeon, and it's really just like school, MCATs, and residency, and there's not really like a lot of conversation around all of the steps that happen in between and kind of how that can impact your experience. Even talking about like having what sounds like a really holistic kind of residency experience that even builds into like being prepared for these step exams and for your boards, versus just having to study it like in a book, but not necessarily like encountering it.
Right.
So I feel like it's a really blind process for a lot of students, and they just don't really have that context for what it all entails.
Right. And this is when it's like a perfect time to talk about diversity in medicine too, because
Yeah.
you say that and the answer is yes and no, because a lot of, at least my medical class was comprised of students who their parents were physicians. So
Mm,
believe it or not, they actually knew way more about the system and the steps and, the letters and the applications than I
yeah.
did. And so I feel like that's why conversations like these are important, and it's important for Black and Brown physicians to mentor and to reach out to students who are interested in these fields, because it's only through representation that we'll be able to increase our numbers in medicine.
Absolutely. And then there are so many like conversations and reports that are now being had around the way that um, the way that physicians like that unconscious bias can then impact patient care and
Right.
how patients pain and
Right.
symptoms and all these things are being dissected. Can you talk about that?
Sure. So I'm actually president of the Diversity and Inclusion Council of my residency, and this is something we actually just had a session on this during one of our noon lectures, because we have a microaggressions and bias curriculum,
Mm-hmm.
and we asked everyone around the room to share experiences that they've had. And so I can't, that was a safe space, so I can't share their experiences, but I can share some
Yeah.
of my own.
Ah,
So, one thing that happens fairly common is that I'll walk in, or here's one situation. I walked into a room, there was a nursing assistant with the patient. I decided to, wait until she was done, because that's the respectful thing to do. Um, but I kind of felt after a couple of minutes that, I was kind of, my presence was just like being ignored, like, oh, whatever. And so and also it was just awkward because the patient could see me and I didn't introduce myself yet or anything. And then I said to the patient, oh, hi, my name's Dr. Ellis. And the NA like turned around in shock, like, oh my God, you're the doctor. Let me hurry up and move. And it's like twofold. One, there's this assumption that because I look the way I look, that I could not have been the doctor. But then two, it doesn't matter that I'm the doctor. Someone else is in the room, you acknowledge them. So it's like twofold, like just respect, in general. And it's just like teaching our peers and our colleagues and our superiors even, like what unconscious bias and microaggressions look like, and the things that we have to face day to day that maybe some of our colleagues don't have to face as much, and so that they're aware of it.
what are some of the biggest barriers that you think a lot of like Black and Brown students face when they're even considering career fields like this? You talked a lot about the exams, but it's also a huge financial commitment. You're talking
Yeah.
about like 8+ years of
Yep.
education,
Right.
and before you can even begin to think about like practicing in a way where you can have like a steady income.
Right,
So
so
there's all
you're
these.
hitting the nail on the head with all the issues, to be honest. It's a huge financial commitment, especially after you're like that you have an undergraduate degree. To decide to do 4 more years of training is a really difficult decision when you could be, working and supporting your family, if that's something that you need to do, if you're of like a lower socioeconomic status and your family really needs your help, to think of all the time and hours that you're going to be spending studying, etc., when that time could go into some type of compensation that could definitely help your family if they're in a pinch. There's that. There's the loan component of it. It's something that used to bother me, and honestly, I'll tell everyone, do not limit yourself and not go into medicine because of loans. There's so many options for loan repayment, to be honest. Like right now, there's like the public service loan forgiveness program, that if you work at a community, like a nonprofit organization for 10 years, all the remainder of your loans just gets paid off. And that includes training. So I'm at Columbia right now for potentially 3 to 5 years. That's already half of it, because most large like hospital corporations are nonprofit. So
Yeah.
the truth is, depending on what you do, as I said, 3 to 5 years is already dedicated to it with just residency. And so there are options to get your loans repaid. And then the truth is, for the most part, the compensation of a physician, you will be able to pay off your loans. And it used to bother me, but then after a while, you're just like, it will get paid.
Yeah.
Yeah.
I have a professor in school, and one thing she said, it's kind of funny, but it's like also not funny at all. She said that her one solace is knowing that her loans will die with her, and that she will
Or
not
even
pass
then,
them on to her children.
that too, it's true. It's just you. So if you pass away, then the loans, that's it. And they're different, like loan repayment, but people approach it in different ways. Like, as I said, if you stay in nonprofit organizations, it just gets paid off in 10 years, no matter how much you owe.
Yeah.
No matter what, there's no like upper limit.
And you talked about the importance of, especially for students who are coming from like underrepresented backgrounds, to have mentors and people who can like pour into them, give them this institutional knowledge and wisdom to help them navigate what can be like a really complex process. So
Right.
how do you go about finding mentors throughout your journey? And who are some of the people who really helped kind of guide you along the way?
So luckily in my med school, it was kind of ingrained in the culture in that they assigned you to a small group. So even though it's 144 of us in the class, they made like little cohorts of like 10 to 12 of us and assigned us a small group advisor who was a physician. My small group advisor was an African-American woman. And what we're trying to bring across to our superiors is that representation does matter. You, just like when you're in, well, at least when I went through undergrad here, you tend to gravitate towards people who look like you, who you think may have had similar experiences and roadblocks, etc., that you might have. You feel more comfortable opening up to those people and asking questions, etc. Because a part of mentorship, of course, that there is this relationship and this like respect. You do respect the person, and it's a professional relationship, but to some regards, that I think, in my opinion at least, a good mentor is also someone where you can break down some of those barriers and open up and be yourself with. And so I'm not going to sit here and tell you that I've only had Black and brown mentors. I've had a lot of mentors who are also Caucasian, but for sure, some of the harder questions to ask were questions that I decided that I wanted to ask physicians who may have had some of similar concerns that I have. It was easier to ask someone who looks like me, honestly. And so I think that's really important. And to be honest, now, after being in residency, it's something that is kind of I would say leading my path into general pediatrics. General pediatrics is a core rotation, and so it's one of the rotations where you'll come across a lot of medical students. And I think for me, I enjoy teaching med students, but also I enjoy that I can be there as a face that people can ask questions, look up to see that, wow, she did it, so I can do it, because that was important for me too. I saw people who looked like me do it, despite the challenges, etc. And so not only did I have those people as mentors, but it just seemed more like an attainable goal.
Yeah. So then what was your journey like to Minds of Jamaica? How did you become a Mind?
So I became a Mind through Camille Ricketts, who's the CEO of Minds of Jamaica. We met we're both involved in JAIA, which is the Jamaican American Youth Alliance. We're in the New York chapter. So both Camille and I are actually in the same hospital system, NYP. So NYP via Columbia and Cornell is the same hospital system. On Instagram, I saw that he was a Cornell PhD. And so I reached out to him actually on Instagram, like, hey, you know, I'm also here. I'm also Jamaican. I see that we work in the same like hospital system. And so we became friends through there. And then he invited me to a JAIA meeting, which is where we met for the first time, you know, got to know each other, spoke about our research and work, etc. And then he told me about Minds of Jamaica.
So what are you, I imagine there's probably not a lot of spare time with all of your work and all the hours that you have to put in. But in the few hours that like you do have, what are some of your hobbies and interests and things that you try to do kind of
Sure.
like to stay sane?
So before the pandemic, I actually really like to travel. I'm always like looking
Oh,
at where's the next destination that we can visit. That's
yeah.
something I enjoy. Locally, I'm a foodie, so restaurant like hitting up the different restaurants and cuisines from various backgrounds in New York was something that I also enjoyed before the pandemic.
Mm-hmm.
And while in ATL, I feel like I would more so go on like walking trails, etc. I haven't really done that here as much during residency, but I would say that that's honestly that's what I do in my spare time, always planning my next trip, etc. I go to Jamaica very frequently before the pandemic, at least 3 to 4 times a year.
Oh, wow.
And of course there we're doing like multiple road trips, etc. And then I also have extended family here in New York, so I'll spend most of my free time with them.
So y'all, we're coming up on the 30-minute mark with Deandrea. If you have any questions for her, definitely please feel free to drop them in the comments before we wrap up. I see here. Oh, it's awesome. We have a couple of mine tuning in as well. So do you live, this is an aside, do you live in Harlem as well? Am I getting that right?
So my program is actually in Washington Heights, and I live in the Heights because the commute's easier, as you can imagine. After those 24s, I just love walking, the ability to just walk home in like 10-15 minutes.
I hear that. Kamir just asked, what are some differences between studying medicine in the United States versus in Jamaica?
Sure. Just a disclaimer, I did not study medicine in Jamaica, so this is all based on speaking to friends who actually went to University of the West Indies, but it's not a personal experience. Some of the differences based on speaking to my close friend, Jamila, who's actually present on this live, is that we have a ton of resources that is just not present in Jamaica. There's certain things that that I want to happen overnight, like imaging, like a CT scan or MRI that I might need to happen stat that just, gets done versus even in my own experience, I thought my grandma had a stroke once and they scheduled her for a CT scan a week later, which to my knowledge is useless because at least the way we use CT scans is to decide whether we need to give you a medication or not, like in that 3-hour period. And so to me, like a week later, if you're fine, then that CT scan, is not helpful in my opinion. At least in the acute setting. And so little things like that. And then we have multiple teams who help us. So of course, like our nurses are like super awesome. They will handle things like taking blood, etc., and seeing to it that they discuss any of the patient's need and patient care with us. They're honestly a truly important resource in our hospital. We have respiratory therapists who help us with like asthma care. We have our pharmacists who, if I'm prescribing a medication for the first time and I want to make sure I'm not giving a too high dose for toxicity, I can call them and say, hey, we have tons and tons of subspecialists. So if I'm worried about like the heart, I can call cardiology. If I'm not sure what infectious diseases is, I can call ID. So we just have, I would say, a ton more help. I do believe that the doctors in Jamaica, in terms of procedures straight out of medicine, you can ask them to throw in any type of lines, etc. We don't necessarily do that many procedures in medicine, but the way that medicine is fragmented in the United States is not necessarily a disadvantage. It's all dependent on where you plan to work and where you end up. Because as you can imagine, the training in US is structured as if you're going to practice in the U.S. So it just depends on where you want to end up. If I wanted to work in the community in Jamaica, I would 100% have to work on my procedural skills before I went back home. And it's actually something I plan to do this year either way because it's important to me to be able to do that.
Yeah. So Mila just asked, what are some of the fears you had about practicing medicine, and how were you able to overcome them?
So I think fears in general, especially with a lot of minorities, is imposter syndrome. You just have this fear that you're not good enough. You don't add up. It's not the same. And no matter what score you get on the test or this, that, or that. And it's once again being minority and not seeing too many people before you achieve the same thing. Sometimes, especially in your own community. So you just have this imposter syndrome of, oh my God, am I going to be good enough? Am I going to know this? Am I going to get it right? And you surprise yourself. And one thing that I do that honestly I would encourage everyone to do, I don't wait on a single person to tell me good job. I know I did something good today. I pat myself on my own back. I'm like, D, you killed that today. You figured that out. You did X, Y, or Z. I don't need validation from anyone else. All my validation comes from right here.
Yeah. Oh, I love that. Mira just asked, a lot of students are kind of pushed into medicine. They're funneled into medicine. They are encouraged to practice medicine by teachers, by their parents. What do you think students should do to kind of gauge for themselves whether medicine is the right fit?
That's a good question, Kamir. So unfortunately, like, ironically, that isn't my story. I wasn't pushed or encouraged. Like, of course, my mom encouraged me, but she didn't like say you must do medicine or nothing else. There was no other acceptable career paths in our home. For example, my sister studied special education in undergraduate school, and she's super successful. I'm super proud of her as well. She's also into like social media and has her own talk show going on called The Labrish every Wednesday. And, you know, I encourage her, my mom encouraged her, we're super proud of her, etc. I would say, though, that medicine is not something that will be easy if you're not passionate about it.
Yeah.
It is hard. There are some weeks I work 80 hours. There are not all weeks. There are some weeks I work 30 hours. But it is hard. It is hard. You give up a lot. There's definitely delayed gratification earlier on, where a good chunk of your 20s is spent studying or in the hospital or studying in the hospital. So you really do have to love it. I do love it, and it makes it more enjoyable and easier. And even when you love it, there are times when you're like, oh my God, I'm in the hospital again.
Yeah.
So what I would say is to do exactly what I did, actually, Kamir. I decided if it's not something that you're 100% into, it's okay to take time to discover what other interests you may have. It's okay to reach out to mentors in those fields and people who are in fields and have careers that you are interested in, to see what their experiences are and to see if you would want your life to mirror theirs. So that's what I would say. And also to recognize that you know, being in medicine and lawyer, etc., they're not the most compensated job, truthfully. If you're talking about money, like, business is the way to go most times. So, you know, creating your own path is really, and walking to the beat of your own drum is really the best thing to do.
Absolutely. And I think that's part of the reason why, like, the work that we do in Minds of Jamaica is so important, because you have so many young people who they don't really kind of know where to turn when it comes to asking those questions about
Right.
what the work really entails and what that path and what that journey can look like. So even being able to talk to someone and be like, okay, this is the real deal. These are the things that you're going to have to, these are the things you're going to have to deal with. These are the things you're going to have to face. If this isn't something that you're interested in or something that you're passionate about, it's maybe not for you.
Right.
Maybe there's another path here.
Right. And it's important for us to be true to ourselves, because I honestly think you bring your best work to the table when it's something that you're passionate
about. Absolutely.
Yeah. And I know that some parents can sometimes be unbearable when it comes on to that. But I feel like with each generation, and with especially the opportunities in you know, social media, etc., that I hope at least that our generation will be more open-minded about that and the pressures that we place on our children.
Mm-hmm. Oh, that's so true. That's so true. And I think we also we have some like very kind of confined ideas of what our careers can even look like. It's
Right.
like doctor, lawyer, teacher.
Right.
It's like, that's it. There's like maybe a handful. And it's like, no, this is 2020. There's a million different ways that you can go, even with like a medical degree or with a law degree. Like there's so many different paths that you can take. So,
and that's one of the things I've enjoyed about being on Mind for Minds of Jamaica. Honestly, I see some of these occupations and I'm like, I'm truly always impressed and just like, oh my God.
Like, so, how did you get there? What's happening here?
Right, exactly. So as I said, I just believe that each individual should follow their own path.
Yeah. Well, guys, we want to thank you so much for tuning in tonight. If you have more questions for Dr. Ellis, please visit us at mindsofjamaica.com and connect with her offline. You can also follow her on social media. Like a ton of great insight here. So definitely like pick her brain and follow up with her. Thank you guys so much for tuning in.
Thanks for having me. Take care, guys.
Thank you.
All right.